for caring during COVID-19, step-by-step strategies for families of children with special needs. And especially during COVID-19, it's so important for families to have a solid care plan on hand in case a parent becomes ill. So tonight's guest presenters, Carrie Noseworthy and Cheryl Ryan Chan, are experts on this topic, and will share some great strategies on how to prepare for an emergency. And this is the first of what we hope will be many more WebEx events on public health topics of interest for families and providers that we'll host in the future. So before I introduce our guests, I'd like to go through some quick housekeeping tips and requests for folks. During the presentation, we will mute your lines to avoid any background noises. And because tonight's event will be recorded and archived for future viewing on mass.gov, please do not discuss any personal confidential information in the chat box. We ask you to use that to share your questions, and we will read them aloud to the presenters, barring any confidential information during our Q&A. For any individual questions, please call our community support line. I'm going to give you the number in just a second, so if you have a pen handy, you can write it down. It's 1-800-882-1435, and leave a message, and one of our specialists will follow up to respond. Again, that number is 1-800-882-1435, and we'll repeat it again later during the presentation as well. I'd also like to give a quick plug to the community support line and 12 other programs in our division that work with families, providers, and support professionals to promote the good health and quality of life for all children and youth with special health needs from ages of birth to 22, and as well their families. The line connects families to resources such as public benefits, care coordination, community-based programs, family-to-family supports, catastrophic illness funding, pediatric palliative care, and much more. So with that, it is time to introduce our presenters for the evening. These are two disability champions that I've known for many years. Both of them are parents of children with disabilities, as I am, and they have used their lived experience to become experts in the field and on this topic of emergency care planning in particular. So our first presenter that I'll introduce is Carrie Noseworthy. She's founded A Safer Me to increase equitable access to safety with a focus on children and young adults of all abilities in their environments. Carrie holds a master's in public administration from Suffolk University, and she also holds a LEND certificate, which is leadership education in neurodevelopmental disabilities, from the UMass Medical School Schreiber Center, and she's also a U.S. Army veteran. She uses the blend of these professional experiences combined with her own lived experience as a sibling and a parent relating to trauma, mental health, and disability to serve as an informed voice of change for families and professionals through training, consultation, and community leadership. And Cheryl Ryan Chan, our other presenter, is a professional facilitator, public speaker, and leader in the disability community. Based in Massachusetts, she provides person-centered planning service and training to citizens and organizations across the United States. Cheryl's son is the namesake behind Nikki's Law, which mandates an abuse registry for those caretakers who have committed acts of substantiated abuse toward individuals served through the Department of Developmental Services, DDS. So before we begin, I just want to give one more reminder that tonight's session is being recorded, and to please use the chat box for your questions, and to share any general questions rather than any personal ones with confidential information. And we will read your questions aloud, and our presenters will answer them. So with that, I want to thank you so much. And Carrie and Cheryl, take it away.
Thank you so much, Elaine. What a joy it is for Carrie and I to be here tonight. I just want to start off by saying thank you again to Elaine and to Sarah and everyone who made this night possible. Carrie and I have been working on our document for a little while to make it ready for tonight. It's actually not the first time we've presented it. This is our second time presenting it. And the first document has a little more information to it, but that's because The origins of this are an interesting story. Many weeks ago, in the beginning, very early parts of this COVID-19 quarantine situation, in browsing and connecting on social media with the community, so many people were articulating their fears about hospitalization and all of the what ifs if their loved one was hospitalized. So I connected with Carrie and I said, we really need to help our community address this. I know that between the two of us with our different capacities and experiences, that we can bring forward some strategies and some information that it can be put together in a really clear, really concise manner for parents, because we also have, as you said, Elaine, that perspective as moms, and we share those fears, we share all of those trepidations, but we also have what we believe are some really good strategies and solutions for preparing for that possibility. So our original document talks about early on in the quarantine, what to do if your own child is hospitalized, and also what to do if you're hospitalized. But tonight we're really focused on preparing for providing alternative caregivers to the ones that we love in the event of our hospitalization. Again, one of our biggest fears: what will happen to my child or my loved one if I have to be hospitalized? Who will take care of them, and how can I get them best ready? You know, a lot of times we're not thinking ahead beyond our fears, and being able to we're not able to really focus in on solutions. We're just, those fears just take over. So what we're hoping is that tonight we'll present the document that will allay some of those fears and help people feel a little bit better about preparing. Preparing is the key, right? Preparing and getting ready is the key. So I'm going to go ahead and start sharing my screen where we have our document ready. We're simply going to present the document just as people will be able to download it and see it, so that there's no confusion. We want to make sure that we are very clear and concise. And so we're simply going to present the document and go page by page and section by section so that everyone understands what each is about. So with that, I will go ahead and do that. Bear with me. All right. So hopefully everyone can see our document. This is the starting page. And when it's time for you to download our document and use it yourself, this is exactly what you'll see. The very first page is simply that legalese that we all have to make sure that we take care of. All it says, for the most part, is that we're not attorneys. We're not, legally responsible for, all of this information. That we guarantee we don't have all the answers. And there may be parts of our presentation that might be incorrect. And that probably comes along with the fact that this thing that we're in, this COVID-19 situation that you were in, is so fluid. It's changing all the time. So we're trying to keep up as best we can. But we created it to support families, and that's really what it's all about. We believe the advice is going to remain relatively stable throughout each stage and change in the pandemic. But you know what? This document has also been written in a way that all of the strategies and tips and tricks that we want to present can be used well beyond COVID-19. This is really a practical guide to what you can do for preparing for any situation where you might need to have an alternative caregiver for the one that you love. So please take what you need from this, discard the rest. And like we said before, we're family members who recognize and appreciate that any information, resources, and support that we can find in any form is going to be good. So with that, don't, like we said, take what you need and sit back and enjoy. I'm going to turn it over to Carrie. She's going to get started on a little bit further into a deeper dive in our guide. Go ahead, Carrie.
Great. Thank you so much, Cheryl. And again, as Cheryl said, thank you so much to Elaine and Sarah and to the Department of Public Health for allowing us this platform to share this information with families. So on page 2 of the guide, like Cheryl said, I'm just going to simply sort of read through and sort of explain what we're getting at here. So on page 2, it says, in this guide, capital A, strategies for planning ahead for care for your loved one. Capital B, step-by-step instructions. C will be tools. D will be other resources. And then E are important messages from the authors. Okay, so on page 3 of the document, under capital A, you will see planning ahead for care for your child in the event of your hospitalization, like Cheryl had mentioned. So this is a scenario that is just as frightening as having your loved one hospitalized. So preparation in advance is the key, right? And we urge you to start from a place of imperfection. There isn't a perfect starting point, so the best time to start is now. Having a plan can dramatically reduce your stress and anxiety about when the time comes. Your loved one is going to become dependent on others in your absence. Decision making will be in the hands of others. Caregivers who step in to be providing the support and information to care for your loved one, and that's up to you. And that's up to you to provide. Here are some of the ways you can plan and prepare and things you need to know. So, creating a guide for caregivers who step in. Many families have created documents that are similar to an LOI, their guide to their own child. If you haven't or need to update your guide, now is the time to do it. So, preparation strategy. Create a letter of intent. That's what an LOI is. According to Special Needs Financial Planning, a special needs practice located in Massachusetts under the Affinia Financial Group, the letter of intent, or LOI, is not a legally binding document, so that's important to remember. However, it is perhaps the most valuable document you can prepare for the future well-being of your child. An LOI outlines in detail the people, places, and services your child receives and requires. An LOI is a guide for future caregivers in making the most appropriate life decisions for your child and helping to provide direction to their trustee in fulfilling his or her fiduciary responsibilities. We found the downloadable sample LOI form provided by the Affinia Financial Group to be an excellent resource. We have provided the link to the form and the webpage explaining more under Tools provided with this document under section E, number 7. And again, like Cheryl said, all of this will be in the document and you'll be able to watch this again and again. So if you don't get something now, don't worry about it. You can always go back. A quick simplified version of a letter that gives the most vital information about your loved one is also available online, provided by an organization called a Courageous Parent Network. The link to download and complete this form is under Tools, provided with this document under section E, number 8. Preparation strategy. Make some videos so you can use your camera phone, demonstrate methods you use consistently throughout the day to communicate. You know, all of our children have different methods of communication, and it's important that their supplemental caregivers have that information. Create schedules, provide assistance, so hand over hand, visual prompts, that kind of thing, with ADLs and other essential activities. Make each video short and to the point, and upload them to a computer and name them, you know, night routine, laundry, meals, getting dressed, so that your sort of stand-in caregiver will be able to easily find this information. And have them on a desktop on a computer, or you can email them directly to the substitute caregiver ahead of time. So a preparation strategy would be practical things we don't think about providing. So this is a partial list we included under are there others in need of care in your home while this is happening in section A of the document. So this could be a routine for the day, morning, bedtime, snacks, in between, things that are relevant to your child, a medication schedule, directions to prepare food, cash for pickup or delivery for meals, your phone number and those of other family members or friends who might also be able to help, and instructions on how to use the remote for TV, Roku, computer, screen passwords, logins, because, you know, whether it's your loved one or the person caring for them, those things might seem trivial, but they could be very important. I'll send that back to Cheryl.
All right. So we are now doing all of this is for the purpose of getting that substitute caregiver really, really ready to just really be able to step right in and take on what's necessary while you're hospitalized or unable to care. So let's continue along those lines. And this is about calling on your circle of support to support the caregiver in your absence. So this is really, this section is about, you know, I think about it this way. If none of us live, like I said, none of us truly provide care in a vacuum, even though that point could be argued by many of us, but truly we all rely on people. And in my world in person-centered planning, that those people are called a circle of support. So the idea behind this is to remember that, let's say you're hospitalized, which is a situation we're preparing for, and you've handed over care of your loved one to someone else. Not only do you need to get things ready in the home and be prepared to be able to transfer all of that knowledge and all of that information to the person in the home, but in addition, if you rely on a neighbor to help care for the lawn or someone else to do other things, then you need to also transfer that information. And including in that, you need to let the alternate caregiver know who the circle of support is, who can step in and help them just the way that they help you. So, like I said, this is the concept of a circle of support, but some of the preparation strategies include this. Think about finding some shoppers and errand runners, even if you need to pay them, if you can. If your loved one prefers not going to the store or can't go to the store, everyone's quarantined and all of that, then your substitute caregiver is going to need essential supplies and meds and all of that, right? So who in your circle or your community might be willing to play that role, again, to support the alternate caregiver? Find them, ask them, put that into place. Say, you know what, if this happens, would you be able and willing to run some of those errands for the person who's taking care of my loved one? Account for how they might be paid if you're going to pay them, and how they will pay for what they're buying. So these are critical things you need to think about now. Are you going to leave cash in an envelope for them? Are you going to do things using Venmo, receipt and then reimburse, paying them online, something? But get a plan together so that these things are already, in advance planned for and prepared. Because otherwise, you're going to leave that substitute caregiver in a real lurch with some real problems that they don't necessarily need to have to worry about. Another planning preparation strategy is make a list of other things that need to be attended to. I mentioned lawn care, pool maintenance. You might be able to do your own lawn and your own pool maintenance. I have both of those things, but don't assume that your substitute caregiver knows how to run your lawnmower or knows how to put chemicals in your pool. You have to get them ready for that, either by getting them themselves ready, making those directions and instructions, or finding somebody else to, again, say, just call John down the street. He knows how to maintain the pool and he knows how to mow the lawn. Then that is taken care of, giving your substitute caregiver that much more attention to your loved one. So again, identify these folks who can support your caregiver in your absence. Go ahead, Carrie.
Thanks, Cheryl. So on page 5, the next thing I'm going to talk about is staying connected with your case manager. So we ask you not to keep your case manager out of the loop regardless of your current status or relationship with them. You might have a great relationship with your caseworker, or it might not be somebody that you're used to relying on. But this is one of those times that Cheryl spoke to, whether you have a large circle of support or if you don't, that this is what case managers are for, right? That's what they're there to do, is to support your family. So this holds true for DDS, which is the Department of Developmental Disabilities, case managers, as well as those for families of all children and youth with special health needs, children with medical complexities, DMH, which is the Department of Mental Health, or any other related services that your child might have. And many of you may have multiple case managers. And in that situation, you want to work hard to make sure that everybody's going to be on the same page if you're going to be hospitalized. Children and youth with special health needs, or CSHCN, have or are at an increased risk for chronic physical, developmental, behavioral, or emotional conditions, and who also require health and related services of a type or amount beyond that required by children generally. That's sort of the working definition. Children and youth with special health care needs and their families often need services from multiple systems, like I've mentioned: healthcare, public health, education, mental health, social services, some of those, all of those, and maybe some that I haven't mentioned. And nearly 20% of US children under age 18 of age have a special health care need, and 1 in 5 US families have a child with a special health care need. So, preparation strategy. You want to call your case manager now, obviously not now, tomorrow. Call your case manager now and talk to them about this scenario. There might be options that you're unaware of. And it's important for case managers anyway, if they don't have all of the answers, it's important for them to hear from their families so they can report back to their higher ups and explain what families' needs are. So you want to find out about any emergency placements in the event that there is no appropriate substitute caregiver, and notify them of the documents you have already put in place and what your own action plan is. Another preparation.
Carrie, I just realized that I have cut and pasted the same preparation strategies from my previous one onto this one. That was a typo that I just realized. My apologies. So
Sure.
skip those because those go back up to caring for the caregiver. I will make that document change and upload it to the places where we are directing you to download the document tonight before you actually go and do that. My apologies.
Sure, perfect. So I'll just wrap up this section by, again, reiterating, please don't assume if your case manager wasn't able to help you through other more typical struggles, that you should not be reaching out to them in this time of need, because that's what the case managers are there for. And this is all of our first pandemic. And like I said, I'm sure they want to report back to their managers as well and supervisors so everybody can do the best they can to support families. And Cheryl, I'll turn that back to you.
Thank you. So the next section is an important one, and it talks about whether or not you are the guardian of your child or adult. So there's two parts to this. If you are the parent or guardian of a minor, meaning under 18, and you are the single parent or sole custodial parent, make sure you provide the alternative caregivers with a letter of consent to make medical decisions in your absence. This is if something happens to your child on their watch and they need medical attention. So there are links to two versions of letters that you can use under tools in this document. And I'll be mentioning those shortly. So that's for parents or guardians of minors. You got to make sure that they have the alternate caregiver has permission and ability to make medical decisions and support your child. Now, if you are the parent or guardian of an adult, first of all, if there's a co-guardian, make sure that that person is kept updated on all the information and decisions that you're making, because that person will be called upon in your absence. So, sometimes people have co-guardians who are there on paper, but they might be far away, they might be distant somehow, and they're really just meant to be, there, like I said, on paper, but you don't get to talk with them too much. Make that a priority. Make sure that they are included in your planning and preparation for this. Now, if there is no co-guardian, there is a temporary but legal solution. Now, we found this, and we are so lucky to have found this. Lots and lots and lots of parents are very fearful about this scenario where they are unable to act as the guardian and act on behalf of their loved one, and there's no one else who is legally able to do that. There is a solution, and we found out about it by consulting with another attorney group, the Special Needs Law Group. Annette Hines is an attorney there, and she let us know that there is a very little known law that allows for appointment of a temporary agency or decision-making authority for another person. Now, we are providing that information in this document, so I'm just going to skip through and allow you in the document to, once you download it, to go ahead and read it again, take a look at their website. But here's what you need to know about this appointment of temporary guardianship. It's only good for 60 days, and then every 60 days you have to print out and re-sign this document, both of you, you as well as the alternative guardian. This appointment only allows the temporary guardian to have the same level authority as you have, no more and no less. And also be warned that you can anticipate that you might be questioned and doubted by institutions, doctors' offices, so on and so forth, to whom you present this document, because it is a very small and obscure part of the Massachusetts statute. Very few places are familiar with it, but such good news that it really does exist and you can utilize this. So we're providing that information in this document. Go ahead, Carrie.
Sure. So we are now on to page 7, preparing to help your loved one understand. So if you're gone suddenly from the place where your loved one expects you to be, their anxiety, fear, and worry will take over. Now is the time to prepare the best, most appropriate, and meaningful method that substitute caregivers can communicate and provide reassurance to your loved one. As many of us know, a lot of our children struggle with transition and change. So a preparation strategy: prepare the dialogue. First, start with the method of communication with your loved one that they use. Some of our children may have multiple forms of communication and we're just sort of so used to it. But it's just so important to communicate that to the caregiver who will be with them, because as we all know, miscommunication and lost communication can lend itself to difficulties, which we don't want to make things more difficult for the stand-in caregiver. So consider reaching out to school teachers, team members, clinicians, anyone like that in your circle of support or any of your providers for help creating a dialogue that will be most effective. Instruct the caregiver to be patient with the number of times your loved one may need to have this conversation about where you are, and tell them to keep it consistent, right? So less is more, typically with our children. So don't make it about what's happening to you as much as what's happening to your child or your loved one, unless that happens to be a situation where it's a trigger for your loved one and they really need to know what's going on with you. Again, less is more. So I'm going to give it back to Cheryl.
Thank you. So along those same lines, preparation and preparing the person, our loved one, for having another caregiver in their lives is really what this next section, that section and this next section is all about. I talk about preparing your ways for your loved one to have some level of control while you're away. First and foremost, I want to acknowledge that by level of control and decision making and a voice in the household while you're away, I understand that there is a wide range of abilities among all of our children. So that's acknowledged, and there may be people who just have very little to no practical communication that can possibly be transferred and taught to anyone else. But to that end, the idea behind this section is really about making sure that we understand that if we start now by helping our children be able to articulate or communicate to someone else the best way that they can, and start working on what that might look like, and start helping them have more ability and autonomy to describing what their needs are, then they're going to be able to communicate better with a future caregiver. All of us are the biggest experts on the people that we love, and there are so many things that happen that we just automatically, we get it, we know what they're saying. So it's just natural as parents and caregivers that we understand, but we have to remember that somebody who's stepping in may very well not understand any of that. So to that end, we could try as hard as we can to teach somebody else our child or our loved one's entire communication strategy, or we could empower our loved one to do the very best that they can to learn how to teach others so that they become a teacher while you're away. So, that also speaks to what I talk about in the second paragraph. Remember that every chance that we all have to make our own decisions and choices builds confidence and self-esteem, and sends a message that our opinion is valued. So that's global, but it's even more important when there's a substitute caregiver and everything in the household is so upside down. All of us, and I'm talking about the folks that are dependent on others, really need to feel like we have something in our control so that we feel confident in the midst of all of this chaos. So stop and think if there's an opportunity to now for your loved one to help make a choice, what to wear, what to eat, what activity to do, what chore to do, what to do with their time, when to go to bed, so on and so forth. Create tools now. Here's the preparation strategy that can be used while you're away. Train substitute caregivers how to use them. Even if your loved one doesn't use visuals, sometimes in the time of crisis, sometimes a visual is the most universal way that communication can take place quickly. So think about that. Think about getting a whiteboard. If there's a choice to be made, write them down or use a picture. Have your loved one think about it as they look at it and allow for processing time. Remember to demonstrate these methods to the caregivers or write them down. There's all sorts of strategies that you yourself are going to be able to come up with. But again, the idea is make sure that you are empowering your loved one to participate in whatever level of decision making they might be able to participate in, because that's just going to help them feel like, again, in the midst of this crisis, they are being heard and listened to, and they have some voice. Go ahead, Carrie.
Great, thanks, Cheryl. So if you are hospitalized for COVID and obviously your child or young adult lives with you, there is obviously a chance that they could become infected as well. So if you're hospitalized and that occurs, we're going to talk a little bit about desensitization again now, hence the title, Desensitization Starts Now, so that you can start preparing your loved one a little bit sort of like what Cheryl was saying, um, not to push them over the edge, but really to kind of tone things down and desensitize them in case someone else has to take them to the hospital if you were in another hospital receiving care. So, are there sensory concerns or triggers that your child, that you're already aware of that your child has? If they're going into the hospital, they may be required to wear a mask, gloves, have their temperature taken with the kind of thermometer maybe that goes across their forehead down the ear. So without triggering your child, big words there, right? Without triggering your child, because you know your child best, you may want to work to desensitize them to this process. So you know your child best. We're just encouraging you to do what you can to sort of chunk away at things to help them be able to access safety. So preparation strategy. You could let them try on different kinds of gloves at first, winter gloves, all different kinds of gloves, right? It doesn't have to immediately be the typical gloves that they would wear in a hospital, and explain that they are a have to and that they may keep germs out or in depending upon how your child processes things. Do you have a mask or something similar to a mask to sort of slowly desensitize them? Maybe a bandana that your child could sort of get used to, or maybe, if they like X-Men or something like that, right? You can order something that some sort of preferred item that they might be more interested in. Um, and again, the intent of these exercises is to desensitize, not to trigger and provoke anxiety. So please use your best judgment, right? This is not something you want to be forcing on your child, right? You know them best. So in planning ahead, remember your child may be seen at a traditional hospital or a non-traditional field hospital. Like right now, the numbers are down in Massachusetts, but like Cheryl said, this is a fluid situation. We could be in this for a year or two, right? So this training, we want to just sort of talk a little bit to different scenarios. So different hospitals might be outdoor tents, churches. We've seen them on ships. Different sites that might be deemed hospitals. So you might want to also prepare your child for sort of, if they're expecting a brick building or the hospital down the street, that might not be where they're going. So those providers may also be covered in head to toe in PPE, right? So we know that to be personal protective equipment. And that might be really overwhelming to them. I mean, it's overwhelming to us as adults. So with sensory needs and processing needs and complex medical needs, we want to try to help to demystify this whole experience and to make it less scary for them. So preparation strategy, you can show them images online, or if you think it would be helpful and have the time, you can show them social stories. And again, take your time. You don't want to be doing anything that's going to put your child over the edge. You know them the best, but just little bits, see their reaction, just like you do with anything else. You may want to do this generally so that they can understand what's happening right now, and it may help them to understand why their schedule in life is turned upside down. That it might not make sense, it may make them angry, but explaining to them that we're all doing our part to keep the country healthy. So maybe if they feel like they're sort of contributing to everything that's going on so they can better process it. So you can find a link to pre-made social stories on COVID-19 under tools in this document. I know that was mentioned under the chat. So Cheryl, I'm going to turn that back to you.
Okay. So remember I was talking about calling on your circle of support to help your substitute caregiver. A lot of this has to do with going back to that a little bit. And this is about what if your loved one needs treatment while you're hospitalized or ill. We talked about this already in a couple of ways. Now, this is the idea behind this is remember that if you have other children in the home, it may be that your substitute caregiver isn't able to go to the hospital with your medically fragile child or your disabled child. That could be a scenario. So this is also about getting ready for that, preparation. So this will prevent you from being, let's see, if you are being treated for COVID, you can't go with them to the hospital, right? So here's some preparation strategies. First of all, identify someone who is willing to go to the hospital and be the support person for your loved one. This may be the substitute caregiver who's already in the house, but it may be different from the caregiver if you are away. So a couple scenarios here. Let's say you're still at home. That might be the case, but so you don't have a substitute caregiver in the house, but you have other children in the home. You can't go with them to the hospital. Here are some strategies. Either scenario, identify someone who's willing to go with them, go over the information in this guide, provide them with all the documents in the list provided in advance of your being in the emergency. So we'll go over that in just a second. There's a bunch of documents that we want you to get prepared for going with your loved one to the hospital, the documents going with your loved one to the hospital. But if you are the one who's going to be going to the hospital and there are still other kids at home, here's another strategy. Identify someone who's willing to come to your house and can respond immediately if there's an emergency. Think through what you can do to provide a smoother transition for them. These things might include a routine schedule for the day, a medication schedule for anyone in the household, directions to prepare food, cash for a pickup or delivery meal, your phone number and those of other family members or friends who might also be able to help, instructions on how to use the remote for the TV, the Roku, and computer screen, passwords and logins. This could be longer term. This might be, a few days. So all of these things, I know we kind of got real down into some detail, but I just kind of throw myself back to the days when I used to babysit and I'd go into somebody's house and they'd want me to show their kid a movie and I couldn't even get their TV to turn on because the remote just didn't make any sense to me. So yeah, we've gone all the way down this path. So again, thinking about who might be able to come running into your home if necessary to take care of everybody, or if you need to stay home, who might be willing to go to the hospital and be that voice. Remember too that with regard to somebody coming into your home, you may need that even if the other scenario might be that your child or loved one has to go to the hospital by themselves. You may need to have to advocate by phone while this is all happening. You're going to need somebody else taking care of those other kids and keeping them out of your way while you're doing that. You're not going to be able to handle all of this crisis and other kids at the same time. So again, we're really starting to think about all those possible scenarios. So get ready for them. Go ahead, Carrie.
Thanks, Cheryl. So I'm on page 10 now of the document, which is step-by-step instructions to prepare your alternative caregivers if you are hospitalized. So this is broken down into 7 parts. The first is to create a packet of information as described under the list of forms and documents to have ready. These are for the caregivers in your absence, as Cheryl had mentioned earlier. We want to place the packet somewhere where the caregivers can find it. And I sort of make the joke, I don't know about you, but I take the most valuable things and I put them somewhere so I don't lose them, and then I forget where I put them. So even if you need to write it down for yourself, right, you want to make sure that they are in a space that you yourself remember, as well as your alternative caregiver. Consider a 3-ring binder clearly labeled care plan. Also, it's harder to lose a binder. You want to download and complete the letter of intent form that we spoke about earlier, the LOI. Find the link to this tool under the tools page of this document under section C, number 7, and also add that to your care plan binder. You can sort of see where this is going. You want to download and complete the Be Prepared for an Emergency form, and you can find the link to this on the tools page as well of the document under section C, number 8, add it to your care binder. Write and sign the medical authorization naming the people you give decision-making power to in your absence for all minors under 18, because remember, like Cheryl said, things are changing quickly, but things could change in your home. You might have 2 people who test positive, and that's what you were planning for, and then somebody else tests positive. So for all of the minors, right, you need to have these documents prepared in advance. So find the form on the tools page of this document under section C, number 6. Also add that to your binder, and create a list of trusted family and friends the caregiver can contact in your absence. Add that to the binder, and leave a list of logins and passwords for computers, house alarms, voicemail on house phones if you happen to have house phones, or however the setup is in your home, and add it to the care binder, because we don't know how long you might be in a hospital. It might be 2 days, it might be 2 weeks, and some people are gone for extended periods of time. So you want to be planning in advance. And for security, you can create a different user profile on your computer in your home with its own password. So that way your private login is not accessible, right? So people don't have access to everything on your computer. You want to give them their own login under their own profile so that they'll have everything that they could possibly need, but then not access to additional information on your personal computer. And Cheryl, I'll give that back to you.
So I'm looking at the time, and I want to honor the fact that we're all here for just a little bit more time. But there's a couple of things that are more important than others that are in this document, and we're going to go under the assumption that all of you are going to be scrambling to download this fabulous document. So I'm going to skip through tools because they're pretty self-explanatory. We have provided a lot of different tools, but they have all been discussed in this document. So wherever you saw a discussion and a strategy and you want to check out the link and the tool that we've provided and discussed, those are on this page. So I want Carrie to just, if she could, Carrie, go right to your behavioral bell curve. I think this is an important piece.
Sure. Thank you very much, Cheryl. I appreciate that. So as Cheryl mentioned, this is a bell curve if you're familiar with it. Typically, we might say if there's a class and they take a test and, the people who got A pluses are on one end, right? And the people who failed are on the other, and the majority of the scores are in the middle. That's what we grew up with. I would like you to use this in a very different way to be able to communicate your child's needs and behaviors to alternate caregivers, providers, educators. So the way I've broken it down is this. So the green to the left of the curve is your child's baseline when they are calm. The yellow to the left of the red is what they look like when they're escalating, but they're still in a place where they can come back to their baseline. Okay, so that's really important. So the green and the yellow to the left of the red, your child can still sort of come back down to their baseline. Red, I call the point of no return, which is going to be different for each of the families listening in today. The red middle and the tip of the curve, I call nightmare scenario, which again, I'm not going to tell you what that is because every family's definition of that is going to be different, okay? Anything to the right of the curve typically is only help with the passage of time and a lessening of triggers, as we as parents typically are aware of. Why did I create this tool? I created this tool so you could scribble all over it, honestly. And so you could communicate to a spouse, another caregiver, a provider, anyone, and explain to them how to best keep your child in what I call the sweet spot, or between baseline and escalation to the left of the curve. I also talk a little bit about the fact that you may not know what works for your child, because if you did, you probably would win a really great award and speak about how amazing you are and how you've cured all of these things and figured all these things out. But for the majority of us, we know what the triggers are, and that's a great starting point. So even if you're starting with the triggers, you can make notes all over this, or if you can't print out the document, you can, I love this tool because you can take a pen and a piece of paper and you can simply draw a bell curve and communicate your child's specific needs, you know, their nonverbal cues, what to do, what not to do. You could do it for, you know, breakfast, this happens, lunch or dinner, or, you know, specific scenarios, whatever you think will increase the likelihood of your child being in a safer place and the caregiver being in a safer place, because we want to increase everyone's safety. So that's it a little bit. I know we're running short on time, but it is, I believe, can be a very profound tool to use to communicate within your family, even with your child directly, so that they can help start recognizing some of their behaviors and have that goal to be, again, between the baseline and the yellow. And again, I really like it because you can just take a piece of paper and a pen and draw that to communicate visually your child's needs in a way that might get lost in translation.
Exactly. Perfect.
All right. Well, I want to thank you all so much. And we're going to take about 5 minutes to take any questions and answers. Thank you very, very much. If you have a question, please put it in the chat box and I'll read it out loud, and we'll get as many as we can get answered in the amount of time that we have. But anything that, let's say we have more questions than we have time, we'll try to put those into a frequently asked questions document that we will post on our website as well. And just to let you know, again, please, no confidential personal information in the chat box, but any great general questions we would appreciate. And then we will share our 800 number at the end of the presentation so that you can call us if you do have personal questions in need of answers on this topic. So here's the first question. Ready? So what happens to a child if the co-guardian lives out of state and needs a day or two to get to the child? Where can a child stay just for a night or so if they have ADHD, are teens, they're quite functional, but immature and scared in this event? So there's your question.
Yeah, so you know, we're not going to have every single answer. It's very individualized. However, I think the key message around that would be whatever that answer is going to be, you need to find that answer now and prepare for it. And that answer the better answer might be finding someone who would be willing to come into your house and just, you know, be there instead of having your child go somewhere else. And then with regard to the guardianship piece, doing that temporary guardianship assignment that's only good for 60 days and having that in place while the travel is taking place and the other guardian is trying to make their way there. So that's a window that definitely has to have some planning around it. And so whatever, you know, think about that right now. Do the research, find the places if that's what the preferred, you know, idea is, but plan now. Go and look at it, get all these documents ready and all of this stuff that we're recommending so that you're communicating as best you can how to caregive for your person. But it's really about planning now. Don't wait and panic at the time. Anything you can add, Carrie?
No, I think you've captured it, Cheryl. And like Cheryl said, you know, even if you're thinking, but who, I don't have, that's why it's so important to start the process now. You know, talk it through with family members, talk it through with friends. Maybe somebody says, oh, what about so-and-so? And you're like, oh, I never thought of them. And so these are the reasons why it's so important to start from that point of imperfection, so you can have everything in place to the best of your ability prior to an event.
And if you don't have anyone in mind, go to the people who know your child that you don't necessarily have a lot of communication with. Go to their school team and ask if there's anyone available there. Tell them what you need. go to, you know, the club that they belong to, find out who those people are, who your child already is familiar enough to with that they might be able to play that role.
And then in an emergency situation, like we mentioned earlier, reach out to as many case managers as you have to try to really kind of get the, put the fingers out there to try to help you, problem solve through that situation.
Okay, great. Thank you, ladies. So we have a quickie, and got probably about 3 more minutes before we start to wrap up. But how can parents co-parent during COVID pandemic?
So, I mean, I guess I would say, like Cheryl mentioned earlier, right? If you have 1,000 different families and they each ask you that question, it's going to look different for each family because everybody is coming from a different place. But I mean, I would just highly suggest that you share this document. And if you are co-parenting and things are going well, then you sort of work through the process together. And if it's not going well, then you might need to decide. I mean, I'm not an attorney, but you might need to decide that you come back, right, with a special needs attorney or someone that helps sort of facilitate and mediate so that you two can work better together. Or, like I said, if you already do work better together, then share the document and collaboratively, piece by piece, go through it together. It really depends upon your relationship.
Right. I agree. Yeah, and that's the beauty of this document. There's nothing here that can't be done by, you know, a small group or two parents or two co-parents. It's very practical. It's very easy to follow, and you could even split it 50-50. I'll do pages 1 through 10 and you do pages 11 through 20. You know, it's very practical and easily followed, hopefully.
Great. Well, thank you both. And exactly, it is practical, and that's what we need right now. So we really appreciate everything that you've had to share. Terrific information. And just to repeat a couple of your main messages, the first one would be prepare now and don't wait. So to all of our families that are listening in, this is something that can give you peace of mind in this moment. So we hope you will use these materials, and of course, take what you need. And again, there's never a more important message than that. And with the information that you just shared, families will be able to do that as well. So there's been a lot of great insights. We really appreciate it. I want to thank you to all of our audience members for joining us tonight. Our recording will be posted on a new webpage for emergency care planning in the section for the Division for Children and Youth with Special Health Needs with other helpful resources in about a week or so. So please go to mass.gov and search on the title of this presentation, Preparing for Caring During COVID-19, to find it. And if you have any personal emergency care planning questions, as I said, of a personal nature, give our community support line a call. Again, that number is 1-800-882-1435, and a specialist will get back to you. And we hope that you'll join us in the future as we host more topics of interest for families of children with special health needs and the providers who serve them. And until then, we hope that you'll stay healthy, that you'll practice safe distancing, and that you will take very good care. Again, good night, everyone. And thank you, Carrie. Thank you, Cheryl, for this valuable information. We are so thrilled to have had you tonight. Thank you both.
Thank you
All
very
right,
much.
take good care. Thank you, everyone.
Good night.
Good night.